And they're all optimal, and all of his symptoms were as well. And I said, good job. Wow, you've really been doing the program. What a great example you are. It's fantastic. And he said, I'm sorry to tell you, but I didn't do a darn thing. I met someone and I fell in love. Is that such a great lesson for a practitioner? Isn't that a powerful, powerful medicine? Isn't that a cheap medicine? What? I want to hear it. Michael, I want to hear it. Mike said there's nothing cheap about it. Well, I'll not comment. This is being recorded. Before you decide that this is brain created, make sure that you are diagnosed by somebody who knows how to recognize these situations, okay? And this was a card that was given to me this week. I thought it was really cool, so I put it on there as a part of our slide. Once it has been ruled out that there is nothing life-threatening, then with the guidance of somebody who's knowing how to treat this, the patient must actively accept that the condition is related to something the brain is creating. The brain is creating to take your mind off of the real issues at hand. This association has to be accepted, has to be reinforced, has to be not believed, but known. And when you get to the knowingness, then we have a placebo effect, but with intention. I'm going to spend just a couple minutes on this because this is where the treatments come from. We obviously don't have enough time to go into many of these or all of them in much depth. But this is where the emotional healing is going towards. First and foremost, if that patient, when I ask them, what makes you happy? If they sit there, if I say, what gets you excited? I said, too long. That was too long. Took too long to answer that one. Here's your job this week. You're going to write down 10 things that make you happy. 10 things that get you excited. Do you know how hard it is for some people to write that? And maybe not a lot of you. But when there's no joy, when there's no spark, it's very hard to find it in your life. So part of their prescription is to find what makes them happy. Because you know what I'm going to recommend they do when they bring that in. We've got to have good sleep. And the only way we get good sleep is by doing some of these other things which we're going to talk about, and that is not drug-induced sleep. I feel one of the most important components to the emotional balancing that I use in my practice that I refer out to is something called the breath class. If you haven't done it, guess what? You're in luck because I brought the breath instructor here to sign you up next week. It's powerful. It's incredible. It's hyperoxygenation. It's nothing that you ever imagined, I promise you. But what happens in a breathing experience? When the body goes into this hyperoxygenated state, it begins to unravel emotions. And people can have crying. They can have laughter. They can have visuals of their past. But it's usually always a very powerful and profound and healing experience. Of course, we recognize stretching, relaxation, and meditation techniques have very similar experiences. We're going to go into those in just a moment. Just talking about it, like we talked about early, let's get our head out of the sand. What's there to be embarrassed about? Find somebody that you can talk to. But we don't want to necessarily deal on, poor me, this is such a situation. We want to talk about it, be done with it, and move into the present moment. And that has a lot to do with journaling as well. Journaling is unraveling the past, talking about it, getting that emotion out, getting that energy. You see, this is pinned up energy is what it is. We've got to get it out on paper. Any and all books or CDs or movies that reinforce, to keep telling your brain, we got to keep telling the brain that this is a mind-body prescription. Okay, that is what we've got to continue doing. There's these little neat machines called biofeedback machines. You put them on your finger and you can actually see your pulse and your temperature. They're wonderful for people that are more analytically minded, and we can say, all right, I'm getting warmer. I'm getting warmer. And as you get relaxed, the body gets warmer and you see the temperature go up and the pulse go down. And several of my patients will come say, hold on, before you take my blood pressure, I'm going to lower it real quick. I was like, cool. Right on. You didn't even come to my lecture and they talked about that. So just good old walking is wonderful. Homeopathy we know is an electromagnetic medicine as well as flower essences. Other types of electromagnetic medicine are sound therapy, light or color therapy, and essential oil therapy. And before I move on, I want to talk as well about another very important treatment protocol which I referred to in the office. For the last couple of years, I've had the experience of working with a great friend and associate and the journey work. The journey is called, it's a book called The Journey written by Brandon Bays. And I'm not going to go into her story completely. This is a powerful way to unwind emotions. Powerful, 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 completely non-denominational, even wonderful work. One more thing. If somebody likes music, I tell them to get out your favorite song. I want you to dance. If you play a musical instrument, I want you to play it. Why? Because when you're playing music, you can't think about how everything else and everybody that ticked you off at work and how much your husband isn't putting the toilet seat down, whatever. What it comes down to is that you get out of the rat race and you get into the present moment. And there's some wonderful literature written about the present moment. The present is the only moment you have. Yesterday's gone. Tomorrow doesn't exist. This is all there is. Which means if we are continually ruminating over the past, what are we doing? We're not living our life, man. So, something I'll have patients do, particularly when they're in an anxiety attack, I'll say, get present right now. Get present. And how do we get present? We put focus. That's why I put these little cute little flowers here. So I go pick a flower, and I want you to look at that flower, and I want you to look at it with such detail that your entire mind goes right to that flower. I want you to look at every single outside detail. I want you to count how many stamens in there. I want you to become so involved in that flower that you are not even thinking about passing out and being sent by the emergency room. We've got to become in the present moment. Biblical teachings as well, another ancient teaching, which is powerful. And I'll read it here. I tell you, do not worry about your life, what you will eat or drink, or about your body or what you will wear. See how the lilies of the field grow? They do not labor or spin. Therefore, do not worry about tomorrow. Some of you already know this. For tomorrow will worry about itself. Each day has enough trouble of its own. My gosh, the answers have been in front of us for so long. How come we're so blinded? One way to get in the present moment is to laugh. I hope several of you have been in the present moment tonight. Thank you. I made the most joyous discovery that 10 minutes of genuine belly laughter from funny movies had an anesthetic effect that would give me relief from pain for at least 2 hours. And this is Norman Cousins, who ended up writing full volumes of literature about laughing therapy and proven to be quite real and quite true many years later, because as we see, science is showing that laughing reduces your stress hormones, cortisol and adrenaline, and increases your growth hormone, increases your immunity, and decreases inflammatory molecules, the very ones that you take to reduce by Tylenol or Advil or ibuprofen. Just by laughing. I hope we've got a few of those tonight. That was good. Also, I think it's quite fascinating. Be conscientious about what you're putting in your consciousness. When students were monitored, they had their immunoglobulins monitored after watching a movie with Mother Teresa. All of their immunoglobulins increased. When they watched a movie that dealt with war, all of their immunoglobulins dropped. Think about what we're doing every day with the news. I mean, we may not think it's much, but I tell you, it's a lot of negativity. Write your troubles away, folks, because patients with rheumatoid arthritis, asthma, breast cancer, and fibromyalgia all had reductions, significant reductions in pain and fatigue and an increased sense of well-being when journaling about the past experience. But of course, what this is for is to unwind the energy, and then we come into the present. We do not dwell on that. Once we're done writing, if you still feel you got more to get out, you write some more. And if the next day you still feel like you're mad at people, you write it down some more until there's no more feeling left with it. Meditation, relaxation. I like to use relaxation more than meditation. They both mean the same thing. What we're trying to do is activate the parasympathetic nervous system. The parasympathetic nervous system is the rest and digest system. It's what causes your breath rate to decrease, your heart rate to decrease, causes your digestion to actually increase, so you have no constipation. Now we have good regular bowel movements. And finally, the circulation comes to your extremities, so you're warm. So what's so fascinating about this is Dr. Herbert Benson, which is one of the original MDs that did this work. He flew out to Tibet because he had heard of these monks that made a circle around them in the snow, melted it all around to keep themselves warm. He hooked them up to electrodes, and sure enough, when they practiced the relaxation techniques, their temperature increased by 13 to 15 degrees. This is mentioned as well in the Bible 45 times. This is not exclusive to Buddhism. When I remember thee upon my head and meditate thee in the night watches. Meditation, relaxation. And what is actually happening? This is incredibly fascinating. Up here, if we look at the time of hours that you sleep in a night, and this is the decrease or the change in oxygen consumption or lactate levels. If we look at the green, this is what normally happens on a night's sleep. This is the normal reduction of your oxygen intake. In other words, the amount of oxygen that you need reduces over the night. This is why sleep is so restorative. This is where our body rejuvenates. In a relaxation response, where you just close your eyes and breathe and try to stop thinking about things, your oxygen consumption drops within 1 hour to a fold that doesn't even compare to a full night's sleep. The lactate levels, which are a metabolic byproduct, are also greatly reduced. What we need to take away from this is that the body is in a hypometabolic state. You're actually decreasing your aging capacity. Don't believe it? Spring chickens do. Those that practice intentional relaxation for 5 years were 5 years younger in their biological age with 80% less heart rate, heart disease, and a 50% less cancer than those who had not performed it. 80% less heart disease, 50% less cancer. Those that had performed these techniques had lower cortisol, but most interestingly, those of you who know about DHEA as being the youth hormone, is something that we want to be boosted up, and when you're young and as a teenager it's high, and as we progress chronologically down this little path called life, it goes down in the ditch. These people right here were able to raise their DHEA hormone by 47%, equivalent to people that were 5 to 10 years younger. So to close, I really, really, really hope that what I've conveyed is that this is huge. This is the highest level of medicine next to miracles, next to a spiritual healing. This is the highest level of medicine that exists. There's no drugs, there's no surgery, there's no vitamins. I'm sorry we'd put Marlene's out of business. But none of them exist. And guess what? We all have the capacity inside each and every one of us. There's a pharmacy with locks waiting for the keys to be sent out. And we do this with the power of our knowingness. And whether you choose to know in the positive or choose to know in the negative, it's up to you. But hopefully after we've heard this, we are aware of what both can do.
For more information on this subject of mind-body medicine, nutritional medicine, detoxification, or any of Dr. Iverson's other services or nutritional products, please contact Trillium Health on their website at www.trilliumhealth.com or by calling 752 7377.